Welcome to Dermat. Dear friends, we have already seen one video on FIV positive cat, and today we are discussing another case, again a cat whose name is Rocky, and he is suffering from Microsporum Canis. It is nothing but FIV positive. So Rocky is an adult neutered male domestic medium hair cat which was initially presented to the dermatology service for a workup of his possible dermatophytosis. He had history of crusting of skin lesions on his face, especially the nasal planum. Now Rocky, when checked that time, his coat fluoresced under the Woods lamp examination. The other cat in the house had skin lesions and also fluoresced. Both cats were treated with 5 to 6 weeks of grisovoline orally and ketoconazole 1% shampoo. The dosage and the details of this medication I am going to explain in the comment box. The clinical signs eventually resolved with this medication, but lesions of Mr. Rocky continued. The other cat became better, but Rocky had still waxing and the nasal planum had crusty lesions on the nasal planum. Rocky underwent a second 5-week course of grisophylline after a recurrence of his skin infection. Upon finishing the grisophylline, Rocky was doing fine, but shortly relapsed again. The owner attempted environmental decontamination because in the cases of FIV, as I told you, we have to completely sterilize the home. How we have to do it? By vacuuming daily. Vacuuming is very important. Not only just vacuuming, but we have to disposing of the vacuum cleaner bag after each use is very important. Also the laundry bag, the linens of all the cat beds and the linens that the cat is coming into contact with has to be disinfected, or most probably you can throw it off, and throwing away all the contaminated items that were not easy for cleaning should be done. Now Rocky was first seen with this fungal culture and Woods lamp examination, and the diagnosis of dermatophytes was done because the Woods lamp test was positive. So Microsporum canis was noticed, and the treatment of ITRACONAZOLE 1.7 ml and ENILCONAZOLE application on the tropical lesions was given to Rocky. Now in spite of this, Rocky is now anorexic and he is peeing next to the litter box, and therefore the medication was discontinued. Now for the last 3 weeks, Mr. Rocky is receiving 2.8 ml of 10 milligram per ml of itraconazole orally once every 24 hours for 2 weeks, followed by 1 week of itraconazole topical application once every 72 hours and half of 5 milligram of prednisolone tablet orally once every 24 hours. Mr. Rocky is eating more since he started the prednisolone, and that he is more active and less itchy now. He has not had any vomition nor diarrhea, but he has been sneezing some of the time last week, possibly more than normal. His nose is little wet, and I think therefore he is sneezing. Now let us do the physical examination. The hair coat is dull and dry with white small scales present all over the body. The crusts on the nose have nearly resolved completely. Now, what are the problems what we have identified? It is nothing but Microsporum canis infection, and the diagnosis is Microsporum canis infection. And what will be the treatment plan which I want to share in this natural surrounding is, dear friends, ITRACONAZOLE will work 10 milligram per ml, continue to give 2.8 ml by mouth every 24 hours for 14 days, followed by 7 days rest of the treatment. Means we have to skip 7 days and again start 14 days of ITRACONAZOLE. So, we have to resume ITRACONAZOLE treatment of other household cat also. Okay. So, this is very important because these both cats are staying together. So, we have to even give the same treatment to the other cat. And the next is ENILCONAZOLE. Continue to mix 5 ml of ENILCONAZOLE with 1 cup of water and apply to the affected skin every 72 hours. In addition to that, prednisolone 5 milligram tablet, continue to give half of 5 milligram tablet, that is 2.5 milligram every 24 hours to Mr. Rocky. So, this was about Rocky. I think Rocky is going to feel better because he is under the guidance of Dermatology. So, consider subscribing this channel if you found this video informative and interesting, and please do not forget to share this video with your friends, and do not forget to press the bell icon to get new notifications for the new videos from Dermatology.